you one of the things certainly that we're a huge proponent of is this notion of bottom up processing.
Yes.
And I know that this is something that you cover there. How about we start there as far as what does that mean? Bottom up processing.
Well, what it means really is that we've forgotten we live in our bodies. But our bodies haven't forgotten us, right? Our bodies speak to us through tremendous kinds of messages through the vagus nerve, through what Steve was so able to really capture for us as trauma therapists. And 80% of the information that comes up into the brainstem is through the body. It's afferent. And in our Western culture, we've disembodied ourselves. White supremacy culture values cognition and really denigrates the body. And we're in the polyvagal world and in lots in the feminist world. And, we're really in somatics bringing the body back and saying, wait a minute, what we've done here is really skewed. We've gone off into celebrating cognitive behavior therapy at the expense of the body and the body processes. So my model brings together two embodied processes. One is introception, and that's where I went searching back there 40 years ago. It's like, how am I going to help these women in work in their bodies? Because that's where trauma lives. If you open your eyes and you sit with your client, it's all there in the body, right?
Right. Yeah, that's how trauma is experienced. It's not,
Yes.
narrative memory. It's physiological experience.
Yeah,
Mhm.
yeah. And the vagus nerve is that through, Steve's term neuroception, that process of neuroception, of noticing unconsciously how safe we are, and then the process of interoception, working with the felt sense through lived experience,
So,
subjective
yeah.
experiencing. And those two embodied processes are what the model is about.